Morning, everyone. We're going to go ahead and get started. My name is Nadeen Israel, and I am the Vice President of Policy and Advocacy for AIDS Foundation Chicago. I'm so happy to be with you all for this morning's Storytelling for Change showcase, Illinois Medicaid. I will be providing brief remarks, which will include a bit of background regarding Illinois' Medicaid program, as well as background on the Storytelling for Change project. I will then hand the baton over to storytelling trainer extraordinaire, Archy Jamjun. Archy will introduce himself as well as the three storytellers, Amanda Link, Maria Kostas, and Melanie Davis. After the last storyteller shares, Archy will facilitate a brief discussion with this morning's storytellers. I will then take the baton back from Archy to provide closing remarks and wrap up this morning's showcase. But first, a bit of housekeeping before we begin. During the showcase, everyone will remain muted. If you have a question or a comment, or just want to show some love for our storytellers this morning, please feel free to use the chat box and the Q&A box. We will be monitoring both throughout the showcase. AFC is recording this session and will be sharing it out at a later time, as well as posting it to our website. Your captions should be turned on. If you do not see them or would like to hide them, go to the bottom of your Zoom window and click on Show Captions. If you click it again, you'll be able to hide captions. If you can't find your captions icon at the bottom of your Zoom window, click on the ... more icon located at the bottom of your Zoom window. There, you will find captions as an option. I want to also now take a moment to thank our funders, without whom this showcase would not have been possible. Legal Counsel for Health Justice, the National Health Law Program, and the Robert Wood Johnson Foundation. Thank you for your generous funding and invaluable partnership. Now let's do a little bit of Medicaid background, shall we? As of October this year, a little over 3.6 million Illinoisans were enrolled in Medicaid. That's 20%, or 1 in 5 of our state's population. Medicaid in Illinois covers children, pregnant women, parents, childless adults, and seniors and persons with disabilities who meet the income, residency, and other eligibility thresholds. 2/3 of adults in Illinois on Medicaid are working, and 61% of the non-elderly Medicaid enrollees in Illinois are people of color. So you might be asking yourself, why am I telling you all these stats? Well, for 3 reasons. First, it's to give you a sense of the breadth, depth, and diversity within the Illinois Medicaid program. Second, it's to help ground the experiences you will hear from the 3 storytellers this morning. And third, it's to help hopefully illustrate a point. At the end of the day today, see what's easier for you to remember. These facts about the Illinois Medicaid program that I just shared with you, or any of the stories you are about to hear. If you're like me, the facts may get fuzzy over time, but the stories will imprint in your memory for a long time. Now, before I hand over the baton to Archy to introduce himself and the storytellers, I'd also like to leave you with 3 takeaways from this morning's showcase, which I will repeat again in my closing remarks. First, remember these stories and take action when called to do so. Second, if you're on Medicaid, update your address with the Illinois Medicaid program. Don't risk losing your health insurance. To keep your insurance, Illinois Medicaid needs to be able to send you paperwork. Give them an address where mail can always reach you. Updating your address is easy, fast, and free. You can do so by calling 877-805-5312 or by visiting medicaid.illinois.gov. And third, consider sharing your own Medicaid story. If interested, please reach out to me following this morning's showcase at nisrael@aidschicago.org. And now, without further delay, I'll hand over the baton to storytelling trainer extraordinaire, Archy Jamjun. Archy, the floor is yours.
Hi, everyone. Good morning. I'm Archie. I'm a storyteller in Chicago, and I'm also curator of Outspoken LGBTQ stories at Sidetrack, which some of you may be familiar with. And today my honor is helping bring these stories together today. We've had 5 weeks of training, a couple off-the-cuff trainings. We've really been working hard on this. Like Nadeen said, stories have the power that data and facts alone just don't have. They have the power to put real faces and situations to these numbers and facts and data that we always hear about. And they have the power to change hearts and minds in a way no power presentation ever will. Studies show that stories are remembered up to 22 more times than facts alone and are more likely to persuade people. So I hope you will remember these stories today and it brings new perspective to your mind. And I really hope if you're in the audience and you have been on Medicaid before or currently are, that you'll consider taking this workshop and help share your story too. So with those words, we're gonna start with our first storyteller. Her name is Amanda Link. Amanda is an actor, director, choreographer, and writer. She is a member of the artistic ensemble at Lifeline Theater, which, if you enjoy storytelling, has a Filet of Solo coming up in January. So it's a great storytelling festival here in Chicago. And she believes in the power of sharing our stories. And she is grateful to be part of this event. So please welcome to the Zoom stage, Amanda Link.
Thank you, Archie. Hello, everyone. My husband and I waited to have children because we didn't know if we could afford them. My granny, who had 10 children while being quite poor, said to never let money be the reason you don't have children. It will all work out. While I loved her sentiment, I at least wanted to be sure my children could go to the doctor anytime they needed. I knew what it was like to not go to the doctor when you should, simply because you couldn't afford it. I hadn't had health insurance since graduating from college, and my husband was also uninsured. But when we finally got health insurance through the Affordable Care Act, we decided we were ready to start our family. For most of my pregnancy, everything seemed to be fine. I made it all the way to 38 weeks, and even that appointment went well until the very end. We were done. We were making small talk as I was packing up my things to leave. The midwife asked if I was getting excited. I said, yes, of course, and then just happened to add, I'm really looking forward to not being pregnant anymore because the itching is making me crazy. Really? Where are you itching? Everywhere, but especially my hands and my feet. We should do a test to make sure everything's okay. No, I don't want to do any more tests. I had to have a special test earlier in my pregnancy because of my family history. And even though it was deemed medically necessary, my insurance still doesn't want to cover it. And it was very expensive. I'm so close to the end. I'm sure it's fine. No, you need to do it. I'm concerned you could have cholestasis of pregnancy, and the result of that is sudden, unexplained fetal death. I had to wait days for the test results. I knew pregnancy could make your skin itchy, so I never thought to mention it. This was my first pregnancy, and I've always had very sensitive skin, so I thought it was normal for my feet to itch so badly it kept me awake all night. I should have realized it was odd that I had started burning my hands with scalding hot water in order to get a few moments of relief from the itching. But I thought, this is what everyone complains about. Pregnancy sucks. But as compensation, you get this tiny little human to love. Now I might not get that. They induced my labor. Every time I had a contraction, the baby's heart rate would dip down and then have trouble going back up. We had already done one very uncomfortable intervention to try to speed things along. Now the midwife said we could do another painful one and still probably end up having a C-section, or I could head straight to the C-section. She left to give us some time to decide. A minute later, though, she came back in and said, we did not have a choice anymore. We had to go to surgery now. It's a boy, 4 pounds, 13 ounces. 4? Is he okay? He was only 11 days early. He should not have been that small. But he was alive and adorable and perfect, except that he couldn't stabilize his glucose level, so he had to go to the NICU. Then he had an oxygen desaturation and had to stay longer. Then it happened again, and he had to stay even longer. We started panicking about how we were going to pay for all of this. We had insurance, but we weren't sure what would all be covered, and our deductible was really high. My husband started doing some research and found out we qualified for Medicaid. While I spent hours giving our child skin-to-skin contact to help him grow, my husband spent hours on the phone making sure they could backdate our coverage so that all 3 of us would have Medicaid starting from the day our son was born. Meanwhile, I had been kicked out of my room. When they told me I had to leave without my son, I cried so hard, my whole face got all red and scrunched up. And when I saw it in the mirror, I cried even more because I looked just like my sweet baby. The nurses in the NICU were very kind, and they let me stay in there as much as I wanted. I was nursing my son in the NICU when a doctor came in and told me they had found a cyst on his spine and would have to do an MRI to examine it, because if it was this certain kind of cyst, it could affect the growth of his legs and create lifelong problems. We had to wait until he was 3 months old before they could perform the MRI. Later, we were told our son might have cataracts and we would need to see a specialist. More waiting, more worrying. Right before Thanksgiving, we got all our test results back. And they were all good. No cataracts, no leg deforming cyst, nothing. It had all worked out. Now he is 7 years old, happy and healthy. I was so grateful to be on Medicaid at that time. With all of the stress, at least money was one thing we didn't have to worry about. Medicaid was able to cover all of it. We were so lucky. But it shouldn't be about luck. Everyone should have access to comprehensive, affordable health care. That's why Illinois elected officials should support the Healthy Illinois campaign by expanding Medicaid health care coverage for all in our state. Thank you.
Yes, I forgot to mention, this is the official applause that we give on Zoom. It's hands up in the air. I think Amanda's story really touches on an important point that when you're going through a medical crisis, the last thing your brain has space for is billing. Like, so important. So thank you so much, Amanda, for sharing that story. If you have any questions from Amanda's stories or any comments, of course, plug that into the chat. And we'll get to the questions after we go through the storytellers. All right, our next storyteller is Maria Kostas. I know her as the mistress of the microphone. But Maria is a Chicago native who started working at 15 years old and has stepped into many different roles since then. She has been an entrepreneur, faculty member, workforce development trainer, a carny, and she worked in the hospitality industry for years, mostly as a bartender, and she still does, I believe. Currently, she is active in the storytelling community and has been on various stages around town. She also teaches meditation, does some psychic energy readings, and adds a touch of love in cocktails she mixes while working as a bartender at the Chicago venue Artifact events. She still cannot quite believe that she has been alive for 67 years, and either can I, because she doesn't look that way. Okay, Maria, come on to the stage.
Thank you, Archie. It started February 1st or 2nd of this year, 2022, with a direct deposit that was more than I was expecting. It was my Social Security check. The amount was more than I thought that I should get. 4 phone calls later and literally hours on hold, I finally reached a supervisor who attempted to explain why I was receiving the increase. "You're on disability," she said. "How can that be? I'm not disabled." "Well, you applied for it," she said, "and it went through and you got the increase. Maybe you don't remember applying." And while it's true, I do have some senior moments, I'm not disabled, so it would never occur to me to apply for disability. Then she started to ask me some questions. She stated what my mortgage payment was for my condo and asked if that was correct, and I said yes. And then she stated what my monthly bills were, and I said yes. And then she said that in 2020, I made $4,000, which was also correct. I mean, it was the first year of COVID. I work in special events, and the whole industry was shut down. I asked where she received all of this information, and she said, from my application, which continued to baffle me. I do remember applying for food stamps, and I wasn't approved. I don't know if they're sharing information. Then she said, "Listen, you can't possibly pay for your bills on $4,000, so you're disabled." Disabled, that's interesting. Anyway, I said, "Listen, in April, weddings are going to start and other special events, and I'll be making money again. Then what's going to happen?" And she said, "Call us later in the year and let us know." A few days later, I received a letter from Aetna Medicare Advantage, the supplemental health insurance program I was on. At the top, in bold letters, it said, "Disenrollment from your Medicare Advantage program." The letter said, and I quote, "Your state has enrolled you into a new plan that will provide you all of your Medicare and Medicaid benefits. You should have already gotten a letter from your state telling you about the plan. You will be automatically enrolled in your new plan, so you don't have to do anything if you want to be a member." My state has enrolled me. What is happening? At the bottom of the letter, it had a number to call, so I called to ask questions about disenrollment. And I was told that I'm now on MMAI. "What is MMAI?" I asked. "Oh, it's complicated," she said. "I really can't explain it to you." Frustrated, I hang up and decide to deal with it the next day. The next day I call and I talk to another representative who was able to explain that MMAI was some kind of a blend of Medicare, Medicaid. But when I asked why I was on Medicaid, I was again told it's because I'm disabled. She then said if I had more questions, I should call Medicare. One day later, I received a letter from the Department of Healthcare and Family Services. And it said, I quote, "You are being enrolled in the Medicare Medicaid Alignment Initiative, MMAI. To help your Medicare and Illinois Medicaid benefits work better for you, we're enrolling you in the MMAI plan. All of your benefits are in one plan." Well, that's great, but I'm still so confused. And the next day I get a letter from Aetna welcoming me to the MMAI plan with a card enclosed. The letter said if I didn't pick a primary care provider, they would select one for me, which they did. And they had a doctor's name on my card who I had never heard of. Now I'm getting a little bit panicked because I do have some health issues and I do want to keep my primary provider. Fortunately, I was able to call Aetna, and to my relief, my primary was in their network. Still, how is all this happening, this MMAI stuff? I let it go all summer as long as I was with my provider. I was happy, but now I need some tests and I want to make sure that I'm covered because I am working part-time and I don't know how long this program's going to last. So I call a 1-800 number that's on my benefits statement. It's a federal number. The federal person tells me that my state submitted my application. He calls it passive enrollment. He also mentions that it could be income-based, and he says every state's different. He tells me to call the Illinois Department of Human Services. He said, that's who enrolled you. I call, I talk to someone there. He tells me I'm QMB. I'm like, what is that? Qualified Medicare beneficiary. It's based on income. I say, is Social Security counted as income? I'm kind of learning what questions to ask as I go along. He says, yes. I ask him how much one can make and still qualify. He gives me an amount and I say, but I make more than that on my Social Security. I mean, I don't want to lie or anything like that. He starts laughing and says, well, you can't lie anyway. We have all of your information from Social Security. No kidding, I think. Don't worry, he said, you're good. But how, I'm asking? How do I qualify? Don't worry, you're good. At this point, I just want to know, if I'm disenrolled from MMAI, am I going to have to pay any extra money back? No, he says. And if I'm thrown off this program because I'm making more money, can I get back on Medicare? And he says, yes. I hope he's right. I'm grateful that I have Medicaid. I've had some issues taken care of. They paid for my blood tests. They paid for my dentist. Medicaid, maybe you should make sure all your representatives receive a glossary of terms, though. For example, income-based qualification instead of disability. Or how about explaining why I was enrolled in the MMAI program? Or if I did complete an application, how about the letter says your application was accepted instead of saying the state has enrolled you? Anyway, Medicaid, I'm good. So I guess for now, I'm good. Thank you.
Thank you, Maria. Oh my God, even in that story, I feel like I've spent more time on the phone than I would like to for an entire year. Like it's like Comcast on steroids, I feel. Oh my goodness. Thank you for sharing your story with us, Maria. And like I said, if you have any questions for Maria, if you can relate to Maria's experience, please feel free to drop a little note in the chat. All right, we've come to our final storyteller, who has been with us from the beginning, working on this story, I want to say for like 5 or 6 weeks now. So she's definitely ready. And Mel is just a girl from the south side of Chicago, Illinois, who recently attended NLU to pursue her BSN. She's passionate about service, art, and all the foods. And if she hasn't tried the food yet, she's open to it. Please welcome Mel.
Hello. So going into the hospital, I knew it. I felt it. Not quite.
Mel, if you can hear us, this is Nadeen. You froze. That darn internet.
Since finding out I was pregnant with my second child, I dreamed of having
Mel?
a...
Sorry, you froze a little bit. Do you mind starting from the beginning again? Sorry about that.
No problem. No problem. Here, let's switch this out.
Melanie, if you can hear me, I think you froze again, unfortunately.
Are we good?
You're good right now, yes.
Okay, good.
Go ahead, go for it.
Okay. Going into the hospital, I knew it. I felt it. Not quite like I was going to die, but like I was going to have another cesarean. And I cried. I cried because I was afraid of dying and leaving my oldest son and possible new child without a mother. I cried because I know the politics of hospitals are unfair for Medicaid mothers like me. Since finding out I was pregnant with my second child, I dreamed of having a peaceful, non-invasive delivery. I felt forced to have a cesarean with my first child. Imagine being 25 in great physical health and being told you're going to have a cesarean because you haven't gone into labor at 40 weeks. It's not uncommon for a woman to have a healthy birth at 42 weeks or even be in prodromal labor for up to 1 week. In my mind, I pictured the doctor maybe having prior engagements he needed to make and couldn't wait. Or even the resident doctor needing one more cesarean to be declared a real doctor. Whatever it was, I didn't need the cesarean the first time and didn't want it again. This time around, again, I don't have high blood pressure or diabetes. I'm in great mental health. My hips may be a little misaligned, and I have a tilted uterus, but nothing that will prevent me from having a safe and natural delivery. Even with all this, the fear of having another cesarean or even dying during or after giving birth lingered in my mind, to the point where I considered delivery at home, even if I had to labor and birth alone. When my water broke at around 1 a.m. in December, instead of being filled with joy at the thought of meeting my baby soon, I was overwhelmed with fear. The mortality rate for Black women during and after childbirth is really high. Black women have a mortality rate almost 3 times higher than white women, but the rate drops when we have our babies at home, at birthing centers, or have Black doctors, midwives, or doulas assisting us. But when you are on Medicaid, those services are just not available or nearly impossible to find. Prior to having my brown, curly hair bundle of joy, I did the research. I looked for Black gynaes, midwives, birthing centers, all the things that would help prevent maternal death, and found that with Medicaid, I wasn't eligible for any of this, and would most likely deliver in a hospital with a bunch of students watching like I'm a lab rat or one of their many test studies. From having given birth before, I also know that once you are in the hospital, you are put on a time clock, giving you up to 48 hours to have your child. But every birthing woman knows, or probably should know, that babies come when they are ready. And as long as you and baby aren't in any danger, you should be allowed the time your baby and body needs to give birth. According to Medicaid.gov, the lower cesarean delivery, or LRCD, which is just a fancy way of saying unnecessary cesarean, rates are high and are even higher based on race. Again, with Black women having the highest rates of LRCD. By having one cesarean, you are almost guaranteed to have another based on your hospital and insurance. And after 2 cesareans, most hospitals in Illinois automatically schedule for a cesarean. Just as I knew it would be, 48 hours later, I had given birth by way of LRCD to my baby boy. After being scared by medical threats, persuaded by very persistent resident doctors, and insistently encouraged by a nurse to get an epidural, although I was managing the pain like a champ, I did. After the epidural, my labor stopped. And because I couldn't walk or switch positions to encourage my baby to come, I was moved from the labor and delivery room to the operating room. Not because there was danger, but because my time was up. I am asking for Medicaid to provide us, women like me, with the opportunity to birth naturally by expanding coverage to birthing centers, doulas, midwives, and for home births, and penalizing doctors for having high numbers of LRCD births. It is my right to have children, and that glorious act of nature shouldn't be impeded upon. Because of my experiences with childbirth, I want to help mothers go into labor without the fear of having that experience stolen from them, or mothers leaving the hospital feeling defeated. I'm going to study to become a nurse.
All right. Just want to say that was Melanie's first storytelling experience, first story she's ever told. And she came through technical difficulties. So I think you're like ready for The Moth and all the big shows, because I mean, you just really proven yourself right there. We're gonna go into some questions now for our tellers. If you have any questions, please drop them in the chat. I will try to find them as quickly as I can. But let's start off with Amanda and Mel. Amanda, you can answer first. So we heard a little bit about your experience giving birth on Medicaid. Did you have any experiences raising your kids the months after using the Medicaid program? How did it go for you?
Yeah, it went okay for me. We were on Medicaid probably until our son was about a year old, I think. Then my husband got a union job and got insurance through that. So that was good. I know early on when my son was just a few months old, we had another kind of scary issue where he needed to get a breathing treatment, and they were able to send us home with a nebulizer type of thing. And so again, I was grateful for Medicaid for being able to provide that for us. That was kind of amazing. So I think in general, it worked well for us while we had it. Although I will say, going off of Maria's story, there was a lot of time spent on the phone and a lot of back and forth always. Medicaid was wonderful and I'm very grateful for it, but it was very challenging to use always. Yeah, thank you.
Mel, do you have any stories or experiences to share from afterbirth?
Yeah, so my experience was fine after delivering my child. The nurses were all great. I was able to use the Medicaid to find a primary care physician for my son. And yeah, it all worked out fine.
Something that strikes me between both of your stories is that you have to have a cesarean kind of on the fly or whatnot. Can you talk a little bit about that moment? How, I mean, Mel, we get a good vision in your story, but any kind of like feelings you had at that moment having to make that decision so quickly?
Yes. So for me, kind of like I said in the story, I felt like that moment was stolen from me. I did all the preparation as far as learning how to breathe, learning how to naturally push. It kind of robbed me of it. And it didn't completely diminish the joy of having my baby. It just took a small piece of it away.
Oh, I'm so sorry to hear that. Amanda, how was that moment for you?
Yeah, I mean, because ours was such a medical emergency, it was just a lot of fear in the moment. But all along, yeah, that's why we went with the midwives, because we wanted to have the most natural birth possible. And yeah, we had all these plans of what we were going to do. And then the whole thing was just, it was so opposite of everything we had hoped for and prepared for. But it was very necessary. I mean, they were monitoring the baby the whole time, and so the midwife was nervous for a while, and then she was like, we just can't anymore. His heart rate is too poor. We need to get him out as soon as possible.
Okay. Thank you. I'm so glad both of your babies came through your labors though. Maria, you're part of this new blended program between Medicare and Medicaid. How's it worked out for you? I know it's been confusing, but actually going to the doctors and stuff, how has it worked for you?
Mostly good. You know, I'm very grateful to have it. I've never needed any kind of assistance before COVID. So all of these kind of things are new for me. I guess, so there are a few things that I wish were different. For example, I needed root canal, and although Medicaid would pay for my new crown, they wouldn't pay for the root canal. So it's kind of weird. And they'll pay for an extraction, but they won't pay for a post. So it's kind of strange. Like I want to keep my own teeth. I'm happy with them. And, also I called about vision, and I was told that I would get new glasses for free. And the person on the phone told me that she checked it, and that yes, Pearl Vision was covered. And so I went to Pearl Vision, And when I got there, they said, no, it's not covered. So then I called them back and they said, oh, that was in Florida, Pearl Vision in Florida. So now I just know to double check everything. And I understand maybe some of the employees are new, working with the program as well. But the main thing is that it's really needed. Healthcare is definitely needed.
Wow. Sometimes you do hear good things about Florida, I guess. We have a question in the chat, and so I'm going to just read it out loud, and if it applies, please feel free to answer. At the Heartland Alliance Social Impact Center, we're exploring Medicaid churn, the experience of losing Medicaid coverage while still eligible for Medicaid, and then having to reapply, and its effect on health incomes, particularly among Illinoisians of color. Have any of the storytellers had experience with losing Medicaid coverage? And if so, how did it affect them? So I guess the question is, has anyone lost their coverage while still being eligible for it?
Oh, so I lost my coverage because I started working a really good job. And then I had to get on my company's insurance, which was not great at all. But getting back on Medicaid, it was a hassle, even though I was eligible for it and everything. It was just a huge hassle. Like the other lady stated, it's a lot of phone calls, a lot of visiting the office. It was just a lot of back and forth.
If you had to quantify the amount of hours that it took you.
Oh my God. I would say at least, I would say 48 hours, because there was times when I sat on hold for like 2 hours, and then going into the office, you're there like a full-time job. It's maddening.
It's a full-time job plus 8 hours of overtime. That's what
yes, absolutely.
Amanda, looked like you had something to say. Yeah.
Yeah, I will say that while our income was still low enough that we qualified for it, my son was actually dropped from Medicaid. Me and my husband still had it, but for some random reason, my newborn child was dropped. And so again, it was more hours on the phone. And luckily it didn't really end up affecting health outcomes ultimately, because they could always go back and fix it, because they were like, oh yeah, he shouldn't have been dropped. There's no reason he was dropped, but for some reason he was. I don't know why. And so I just also wanted to add, I was really lucky that, because I could not handle it. I was like so worried about my son, like particularly when we were trying to schedule that MRI, like we had to figure out who was going to do that and all that. And I like couldn't handle it. One day I was talking on the phone with somebody and it was just making me crazy. And so I passed it all off to my husband. And so I could focus on the health concerns and he could focus on the like dealing with all the technicalities of it. And so I just can't imagine, like, what if the person who was suffering, like, what if I'm in the middle of dealing with cancer and I'm very sick, and yet I have to be on the phone and talking to these people who are frustrating me? I can't even imagine. And so I think that is so important to try to simplify it in any way you can, because yeah, when you're in such a heightened emotional state, you can't be sorting through all of that confusion. I think it's so challenging, and it adds stress, which is not good for your health. So I think.
Yeah, and I think not only when you're dealing with your own struggles, but if you were a single parent, if you had to balance the child and dealing with Medicaid, that would probably be so much stress and too much, perhaps. We have Maria. Can you?
I have not. I haven't been.
It sounds like though next year you might be able to answer that question, possibly.
Sounds like I might be.
All right.
I do want to say that I do have a case manager, which has been helpful. So AARP magazine has labeled me a solo ager. So that's a group of people who, if you're single, which I am, and they have no children, which I don't have, so I'm aging as a solo. according to AARP. So it's really nice to have a case manager. So thank you, Medicaid, for that.
I will be solo aging with you. All right, our next question comes from Elizabeth Evans. It's for Maria. I am curious about your thoughts, impressions of the kind of training, information, and support the people that you're trying to get help from. I have the impression that frontline Illinois government employees are not set up to succeed, and I wonder how we can even begin to think about fixing that. Do you need me to repeat?
Just the beginning of the question.
So Elizabeth is curious about your thoughts and impressions of the kind of training, information, and support the people that you're trying to get from the people that you're trying to get help from. So like the people on the...
Yeah. Well, my impressions are that they do not receive enough training. For someone to... 3 times I was told that I was on disability, which to me, disability means otherly abled, like in some way, you know, disabled, like unable to work. So, you know, some of those people were using the wrong terms. And I just think it's lack of training when I see that kind of thing happening. I think they need more training.
Well, so we have 3 questions that are just kind of general questions for everybody. So I'll go ahead and start with the first one. We've got a very diverse audience with us this morning, members of the public, people on Illinois Medicaid, Medicaid decision makers, providers, and advocates. Our storytellers, if there is one thing you want them to know about people who are on Illinois' Medicaid program or who have been on in the past, what would that be? And I'm going to toss it first to Mel.
Can you repeat the question one more time for me?
Yeah. If there's one thing you want people to know about the people who are on Medicaid, what would it be?
We're human. We're not just numbers. And our health matters as well. Yeah, I would definitely say that.
Yeah, I think that's probably the most important thing that can be said. Amanda, do you have anything you'd like to add?
Yeah, just that we are the same as you. You know, we are trying to make the most responsible decisions we can for our families. And yeah, we have the same fears and hopes that you have. And, you know, yeah, that's it. Thank you.
Thank you. Maria, any thoughts?
Well, there is the issue of the working poor in this country. So there are a lot of people who are working and still need assistance, and health benefits are just so important. So I think I just want people to realize that some people can be working part-time and or full-time, and they still need assistance, and medical assistance is really, really important.
That's an excellent point. For everyone, and I'll go backwards this time. So Maria, you'll start this first. What motivated you to share this particular Illinois Medicaid story and experience?
Well, for me, if I were to ever go out on the streets and march again for anything, it would be for healthcare. I just think that it's so, so important.
Thank you. Amanda, you're in the middle.
Yeah, I agree. Healthcare is so important, and I just feel like sharing our personal stories is such an effective way of understanding each other and connecting with each other. And so I was so excited to get to be a part of this because I think it's brilliant and important and useful.
Then Mel, I know we did like brainstorming in the beginning. How did you arrive to telling this story about the birth of your child, second child?
So the story is deeply important to me. The having unnecessary cesareans and how it limits how many births you can have, and the toll it takes on your body and your mental. I think it's important for everyone to know, like, cesareans shouldn't just be handed out like candy. Yes, there are, emergency situations where they are absolutely necessary, and I am thankful for that life-saving tool. However, it shouldn't be done just to get more money out of Medicaid, or it shouldn't be done because of a time crunch or a time limit or things like that. So it's a very personal, deeply personal story for me. And I appreciate you letting me share. Thank you.
No, yeah, definitely something I learned working with you was how many low-risk cesareans happen, and that time clock that women experience when they go to have their babies was really like stunning to me to learn that. All right, the last question here, and I'll start with Amanda this time. If you had a magic wand and you could change Illinois Medicaid program to make it work better for everyone, what 3 changes would you prioritize, or what any changes would you prioritize? I know it can be hard to come up with 3. But.
Yeah. I think the first one would be to make sure that all the different providers are accepting it. You know, like you mentioned that you were having trouble finding a midwife, for example, or that kind of thing, just so that people on Medicaid have access to all the options that they might need. And then the other big thing that I could think of is just to try to simplify the process as much as you can, just so that people are not spending so much time on the phone, and there seems to be a lot of miscommunication and mistakes. And so obviously it's not an easy fix, but if we've got a magic wand, why not make it easy?
Good point. We could all use wands. Maria?
I think if I had a magic wand, I would ask for more preventative medicine to be included, like acupuncture. To me, to pay for an extraction or to pay for a crown but not a root canal makes no sense. So just more coverage would be nice. More training. There's a lot of hang on, let me check with a supervisor, or I don't know, let me find out, or I'll call you back. There's a lot of that. So that seems to be training issues. Yeah.
That's so important, because I don't think we ever think about that when we talk about healthcare issues. It's like the training of the people providing information is something that really goes over our head when we talk about big policy issues. Mel? Would use your wand, what would you do?
Oh my goodness, if I had a magic wand, I would do everything that the ladies already mentioned before, but I will also make it so LRCDs, low risk cesarean deliveries, are like just completely thrown out unless it's elective, and of course if it's an emergency situation, that's something completely different. But for doctors to decide for you, like, hey, I'm just going to go ahead and give you this cesarean because I have dinner appointments, that stuff will be completely thrown out, and doctors will actually be penalized for it.
Thank you. That is a great suggestion. That concludes our question and answers. Thank you for fielding questions on the fly. I know that can be really difficult. I think you all did really well. You're ready for any Miss Universe pageant you would want to enter, considering Medicaid. And I'm going to hand it back to Nadeen.
Thank you so much, Archie. Thank you all so much, Amanda, Maria, and Melanie. Folks, let's show them all some love again in the chat. Thank you, thank you, thank you. Your stories are amazing, your experiences, and we're so appreciative for y'all for coming on today. All righty. So that's all the time we have this morning. Let's again give Archie and our storytellers, Amanda, Maria, and Melanie, lots of love and appreciation in the chat box for being with us this morning and sharing their Medicaid experiences and insights. I'd also like to thank my AFC colleagues, Aces Lira and Dominique Chu, for their support of today's showcase, as well as the AFC communications team. Please give us feedback on today's showcase by completing the post-event survey. It should take just about 5 minutes, and my colleague Aces will drop it in the chat momentarily. You'll also get it in an email, in the follow-up email after this session. And finally, I'd like to remind you all of the 3 takeaways from today's showcase. First, remember these stories and take action when called to do so. An easy way for you to take action is by joining AFC's Mobile Action Network. And again, my colleague Aces is going to drop the link for that in the chat momentarily. Second, if you're on Medicaid, update your address with the Illinois Medicaid program. Don't risk losing your health insurance. To keep your insurance, Illinois Medicaid needs to be able to send you paperwork. Give them an address where mail can always reach you. Updating your address is easy, fast, and free. You can do so by calling 877-805-5312 or by visiting medicaid.illinois.gov. Third, consider sharing your own Medicaid story. If you feel inspired and interested, please reach out to me, Nadeen Israel, following this morning's showcase at nisrael@aidschicago.org. Thank you all for tuning in this morning for the Storytelling for Change Showcase, Illinois Medicaid. I hope you have a fantastic rest of the day. Bye for now.